When I was 13 years old, I remember having a conversation about hepatitis B for the first time.
Hepatitis B is an infection, so it's a virus that likes to infect the liver.
All I could feel was this sense of anxiety inside me. The only thing I could think of was that I didn't want to live anymore.
In our young population, I strongly believe they will have curative options in their lifetime.
The possibilities have been opened for me. I wake up every day thinking about what life has to offer. I was born in South Korea in February of 1989. I grew up with friends and family all around me with active interests and hobbies, and there was never a point in my childhood where I thought something was wrong.
When we adopted David, it was 1989. We already had our first son, Aaron, and he also was born in Korea. We heard about David, and he came at 5.5 months old. We knew from his paperwork that his birth mother was probably a hepatitis B carrier. But he had received the shots over there, the shot that you receive right after you're born. So we figured that David was protected. There was a doctor in the area, and he was the one who said, if your child is from Korea, you do want to have them retested. So I came home with that information, and David turned out to be positive.
My name is David, and I have hepatitis B.
Hepatitis B is an infection, so it's a virus that likes to infect the liver. It's not the only liver-directed virus, but unlike other viruses, this one is not a curable virus yet, hopefully yet.
The information that we were given is it would be better if this was kept confidential.
When I was 13 years old, I remember having a conversation about hepatitis B for the first time.
He wanted to have a girlfriend. He wanted to do all those things that we were going to be cautioning him. No, you can't do it right now. So we told David.
I remember when I was being told the first time, it was like I was hearing all the words she was saying, but all I could feel was this sense of panic, dread, and anxiety inside me. I remember hearing that I could live a long and healthy life with regular monitoring, but at that time, I was thinking of my future and what that looked like, and I wanted to ask so many more questions that day, but all the feelings were so overwhelming that I shut down and just listened.
And in individuals who get this infection, the outcome can be variable. Some people are able to contain it themselves. Some people, their immune response to this virus causes liver injury. And some people really have very healthy livers, but then have an increased risk of developing liver cancer. Other people can become very, very ill. And although it's uncommon, can become so ill that they go into liver failure and require a liver transplant, usually, a few weeks after that initial infection. Because hepatitis B is an infection that tends to be in body fluids, most of the time the risk factors are either maternal to childhood transmission, that means you get it at the time that you're born from your mother, and globally that is the most common way of getting exposed to hepatitis B, or very early introduction in childhood, so like living in a house where people have hepatitis B, you can get exposed. And then the other common time to acquire hepatitis B is when you are engaging in higher risk factors. So in the United States, going to the barber and going to the dentist are pretty safe, or getting dialysis pretty safe. But if you live in a community or an environment where hepatitis B is more common in the background, then these everyday exposures increase the risk of getting exposed to hepatitis B.
The months that followed were very difficult. I returned to the second half of my 8th grade year with feelings I had never experienced before. I had trouble focusing in class. I had no interest in hanging out with friends or extracurricular activities. I started to withdraw from everything.
It got to be a struggle. He just did not want to go to school anymore.
The only thing I could think of was that I didn't want to live anymore. So I found a bottle of Advil in my parents' medicine cabinet. I had remembered hearing from the doctor that drugs like that can damage your liver, so I thought that if I took enough, I wouldn't be waking up the next morning.
I think that anxiety and depression, when you find that you have a chronic disease or a chronic infection, is significant. Someone could be told very early they could grow up knowing they have an infection, and that could also be somewhat paralyzing for how they engage with the people around them.
When I did wake up that morning, I went and got my mom and dad from their bedroom, and I told them what I had done. They responded with the same look of concern and care that they always do, and they drove me to the nearest hospital. I would be seeing a psychologist and psychiatrist. During my early to mid-20s, I alternated between being in denial, taking care of my disease, and also not caring. Some years, I would get my liver function test. Some years, I wouldn't talk to my doctor at all.
Prognosis is an interesting conversation. If you do not receive any treatment, if you just hide, your head and ignore your virus, then there's a risk of about 1 in 3 individuals having complications of either significant liver damage or liver cancer. If we identify someone at risk of liver complications early, before their liver is damaged, and we get them on appropriate treatment, that significantly decreases the risk of liver damage and liver cancer. Trying to start someone in their adolescence on a lifelong medication or something that requires a lot of monitoring isn't always easy.
Hey, Pop.
What are we having today?
We are making some gazpacho from
Often, treatment will start in someone in their 20s or 30s before they have significant liver injury, but also at a time when we show that they aren't able to control the virus on their own, and that this medication is going to decrease the risk of liver cancer and developing liver damage, and they are ready to take a medicine that could potentially be a lifelong therapy. And so one of the most important things is to continue to have an ongoing relationship with the person who's providing help with your health, so that you identify if and when you need treatment, or if and when you're at risk for a complication early, when we have lots and lots of options in front of us.
I remember that day I came home and my parents asked me if I wanted to eat dinner with them, and I followed my mom and dad out to the backyard where their vegetable gardens and beautiful flowers are planted. When we started eating, I felt something deep inside saying that this is an important moment. Do you want more moments like this? That this was a huge part of what makes me, me, and what makes me want to be alive on this earth. That dinner was the most memorable dinner of my life so far.
He's met a wonderful person, Gabby, and they both come over frequently.
We have a lot of very open communication, so I'm never afraid to ask him anything. He's never afraid to ask me anything. We just work through it. We love each other. We're here for each other. And yeah, I'll be here.
I feel like that holding back, that anxiety that I felt also for a long time, that it's gone now. I feel like David is a man that I'm very proud of.
Growing up, I remember one of my main concerns was the potential of spreading my hepatitis B to another person. It wasn't until after my biopsy and I started taking the antiviral medication. Once I knew that I had a confirmed undetectable viral load, it made me feel little to no worry about spreading hepatitis B to another person.
In our young population, I really emphasize that I strongly believe they will have curative options in their lifetime. We have so many medications in development that have what we would describe as functional cure. That's not necessarily the best term, but it suggests that we might be able to push your virus into being quiet without requiring a long-term treatment.
I started to try to learn more about hepatitis B and eventually came across the Facebook page of a nonprofit called the Hepatitis B Foundation. I saw for the first time pictures of people that had what I have.
Going into advocacy work for hepatitis B has been perfect for him.
Meeting others, being able to share stories with them, hearing their problems that specifically related to hepatitis B. I wake up every day thinking about what life has to offer. I used to wake up thinking how I could end it all. The possibilities have been opened for me through community, through education, and through love. And that's something that I'll carry with me for the rest of my life.